first dental visit. Dental caries is a preventable disease with significant morbidity. If left untreated, it can lead to pain, infections, and severe life-threatening events. Early dental visits can prevent suffering, reduce the amount of money and time spent on future surgical and emergency dental services. And this can maximize the chance of children to grow up with healthy and happy smiles. The first dental visit is an important milestone in the child's life, and a timely first visit should be essential part of the child's general health care. The age of the first dental visit of the child helps in determining the quality of the preventive dental care that the child will receive and thus the future oral health of the child. The American Academy of Pediatric Dentistry, American Dental Association, and Australian Academy of Pediatric Dentistry recommend that a child should visit the dentist within 6 months of the eruption of first primary tooth and no later than 12 months of age. Basically, the child has to be seen by a dentist before his first birthday. An early dental visit before completion of 12 months of age will help the dentist to detect early carious lesions, evaluate the craniofacial and dental development of the child, provide anticipatory guidance, parent counseling, diet counseling, and even motivate the parents towards prevention-oriented interventions. Coming to the child first dental visit, it should be organized in such a way that it becomes comfortable and enjoyable experience both to the child and a caretaker. It should be nothing more than an introductory icebreaker to acquaint the child with the dentist and the dental office or the dental clinic. The first dental visit is more or less a mutual assessment session wherein the dentist assess the child and his or her caretaker, and the child or the caretaker in turn assess the dentist and the dental team along with the dental office or dental clinic. It is also an important occasion for the parent to address his or her own anxiety and fear of dental care, which in turn may reflect in the child's behavior that is being shown in the dental clinic. And during the first dental visit, we expect certain behavior from the parents also. The parent or the caretaker should remain strong, supportive, and work along with the dentist in providing the treatment to the child. And the parents or the caretakers should not insisting on starting the treatment from the first dental visit itself, because it is better to institute preventive programs and non-invasive procedures in the first dental visit that rather than invasive procedures. And the parents in turn should allow some alone time for the child and the dentist and give the dentist enough time to talk with the child. And this will help to create a bond between the dentist and the child patient. And this time that is spent initially on building the rapport and gaining the child's confidence will in turn save a lot of time required for the treatment later. And while talking to the child during the initial visit, it's better to use terms that the child can relate to, and dentist should try to create a positive experience for the child. And obviously, crying is perfectly normal during the initial visits. We should inform the parent beforehand that the child may exhibit his anxiety or fear through a cry. Certain goals has to be accomplished during the first visit, and these goals can be either behavioral, diagnostic, preventive, or therapeutic. And the goals that has to be achieved on the child's first dental visit include: first one will be making the first dental visit of the child as comfortable and enjoyable as possible. This is the foremost goal that we should try to achieve. That is, making the first dental visit of the child as comfortable and enjoyable both for the child and the caretaker. And again, we should familiarize the child with the dental environment. That is, we can allow him to take a stroll in the clinic or the office. And further goals will be to detect and control different dental and oral pathologies at the earliest. We can assess the level of caries status in the child or the level of oral hygiene, etc. We have to document it. We should also clarify the patient's role in supporting the child emotionally before, during, and after the first dental visit. We have to cater the parents with information on proper oral and facial development. All these goals has to be accomplished following a first dental visit. The parent and the dentist have to play certain roles to make the first dental visit comfortable and enjoyable. And a child's dental visit can be made successful by a few pre-appointment preparations, both from the part of both parents and the dental team. Coming to the role of parent in making a first dental visit enjoyable, these are the things that can be done. First thing is that they can allow the child to bring his or her favorite toy, preferably a small one, to their first dental visit. They can have their favorite toy in their hand, and they can also ask the dentist about the procedures that will be carried out in the first appointment so that there are no surprises. Preferably, no invasive procedures to be carried out in the first appointment. To go with non-invasive procedures like fluoride application or simple scaling or just routine examination will do. And we can ask the parents to avoid conversation in home that might include unfavorable references to the dentistry. And they can also avoid voicing their own fears about dentistry in front of children. All this will create a negative impact on children's behavior. And they should never let the child hear of any past dental experience that were traumatic or generally bad experiences. And they have to let the dentist know of any physical or mental disabilities the child may have, or even any past negative experiences with in the medical or dental field. The more informed the dentist is about the child, the easier it will be for the dentist to work with the child so that he can make his first dental appointment a pleasant one. And the parent has to plan a course of action depending upon whether the child will exhibit a cooperative or uncooperative behavior in the dental clinic. To do some exercises like role play in home, like the parent can play dentist with the child. That is, they can sit down with the child count his or her teeth, just touch the cheek or gums with some spoon or something. Just get the child comfortable with having fingers in his or her mouth. And let the child then be the dentist, and we can just reverse the role play. And they can ask the child to be a dentist for some time and allow him to count the parents or caretakers' teeth. There are some stories or movies in wherein the child character will be going to a dentist. Children can very well relate to characters in a book or on the screen in their young age. So if they see their favorite character shows no fear and is having a good time at the dentist, it will obviously help the child to be less afraid and when he or she visits the dentist for the first time. And the parents should try to schedule an appointment with the dentist wherein the child is most comfortable. And the parent or the caretaker will be having an idea when the child will be most active or most comfortable time of the day. So they have to schedule their first appointments, initial appointments with the dentist at that time. And simply inform the child that either on the morning or on the day before that he or she will be taking a visit to the dentist. And while making the visit, they have to carry any medical records, if any, to the dentist also. And while talking to the child about the first dental visit, the parent has to keep it positive, short, and simple. The caretaker can inform the child that the dentist will be just going to count his or her teeth, and he will be helping the child to look after their teeth in a better way. They have to try to build excitement as well as understanding about the upcoming visit. So from the part of the parent, all these above said things will help to make the first dental visit of their children a better one. Now, the dentist or the dental team also has to play or has to perform certain duties to make the visit a pleasant one. First thing would be to mail or send them a booklet or brochure beforehand, or they can hand it over to the parents while they are waiting in the reception during their first visit. And this booklet or brochure should contain information regarding the preparation of the child for the first visit, thereby increasing the likelihood of a successful first appointment. And the brochure or the booklet should contain the procedures that will be preferably carried out during the first dental visit. And this is going to alleviate the anxiety and concerns of the parent to some extent. And again, the dental team can allow the child to bring a small toy with her, and they can send a video showing a child of comparable age exhibiting a positive behavior in the dental clinic. A behavior guidance technique called modeling can be used. It can be the video or a booklet sent to them via mail, or they can be displayed in the reception area. It is mandatory that the dental clinic to be child friendly, especially the child should not be taken into an operatory during when they step into the office. It has to be a child friendly room, preferably in an area that preferably not in an operatory. And a comfortable environment has to be set up where the child can open up to ask questions or explore around the dental office on his or her own. Okay, so these are the roles that the child, the caretaker or parent and the dentist has to play in order to make the first appointment a pleasant one for the child. There are certain procedures that can be preferably carried out in the first visit. Every effort should be made by the complete team to make the visit enjoyable. For this reason, it is advisable not to carry out any invasive, stressful, painful or traumatic procedure on the first visit unless it is a necessity. For example, if a child reports for his first dental visit following a traumatic injury, certain invasive procedures has to be done. In other cases, it is better to avoid any invasive procedures. So the following procedures can be performed in the child first dental visit. The first one is to record patient's demographic details, chief complaint, history of present illness, prenatal history, natal history, postnatal history, family history, the medical history, both current and past one, the dental history, if any, personal history, and diet history. And following documenting all these things, you can go in for the general, extraoral, and intraoral examination. And even radiographs can be obtained if required. Once radio investigations has been done, treatment plan can be formulated and inform the caretaker or parent about the financial aspects and the approximate number of appointments required for the completion of the entire treatment. And you have to emphasize the need for preventive as well as operatory treatments that is being required for the particular case. And counseling regarding diet, injury prevention, oral hygiene can also be done. And the most important thing is to demonstrate age-appropriate oral hygiene measures. That is, proper toothbrushing has to be demonstrated, and information regarding who has to brush the teeth, the frequency of brushing, which tooth cleaning aid to use, etc., has to be conveyed. If the child presents with an emergency on the first dental visit, obviously you have to attend to any emergency and treat for pain if present. And following this, you have to assess the child's caries risk. That is, the child's systemic and topical fluoride status has to be assessed, both from the diet and from exposure to topical fluoride like fluoridated paste. And the fluoride exposure has to be optimized. If required, you can prescribe systemic fluoride supplements. The main three important things is that you have to establish dental home in the first visit and assess the patient's risk of developing caries. That is, you can use questionnaires or desktop or mobile application to assess the caries risk and determine an appropriate prevention plan and interval for periodic reevaluation based on the caries risk assessment. Again, you have to provide anticipatory guidance pertaining to dental and oral development, what to expect the development of teeth and the circumoral structures, the effects of diet on dentition, fluoride status of the patient, injury prevention, effects of non-nutritive sucking habits on developing occlusion and orofacial structures, oral hygiene, meticulous oral hygiene instructions, and problems with teething. All these things has to be mentioned in the anticipatory guidance. And to conclude, dental disease can have devastating effects on young children and their families. And the treatment of dental disease most times are costly. Strong clinical, theoretical, and scientific evidence supports early dental visits to improve health outcomes and reduce dental related costs. So as recommended by AAPD, IDA and other pioneer organizations, it is better to have the child's first dental visit within his or her first birthday. Thank you.